Hi, and welcome to today's webinar, Economic Development and Health, a community's journey toward a living wage. And I just want to start by thanking everybody for joining us today, and we're excited to share more about this topic and hear from our guests, which I'll introduce here in a second. I want to begin by acknowledging that County Health Rankings and Roadmaps is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. And my name is Aliana Havrella, and I'm a community coach with County Health Rankings and Roadmaps. And I'm joined by my colleague, Erica Burrows-Girardi, who's going to be helping us with using some of the technology today. Hi, Erica.
Hi, and thank you for joining us today.
And now I'm excited to introduce our guests for today's webinar, and I'm going to start with Linda Rubin, who is the Director of the Healthy Community Initiative, Healthy Monadnock. Welcome, Linda. Linda, you might be on mute.
Sorry about that. Hi, everybody.
And next, I'm excited to introduce Phil Suter, who is President and CEO of the Greater Keene, New Hampshire Chamber of Commerce. Hi, Phil.
Good afternoon.
And now I'm going to turn it over to Erica, who's going to walk us through some slides to get us all oriented to the Zoom technology. And I'll just let the audience know this is my first time hosting a webinar in Zoom, so I'm excited to learn with everyone.
Hi, can you hear me, Ali?
I can.
Great. Thank you, everyone. Some of you did sign on early enough to see that video that we had in the beginning to tell you about how to use the user controls. But for those of you who are just joining us now, I want to share two functions with you that'll help you interact with us. Let's start by telling you how you can ask a question of us. You can submit a question by using the user control at the bottom, the Q&A box. Simply click on that. When you do, another window will appear for you to ask your question. And all you need to do is enter your question into that box and click submit. Now, we want you to use this Q&A box if you are submitting a question of the panelists that you would like to ask the panelists. And Ali, if you will click one more time, it'll show our viewers, that arrow will come up and let them know exactly where they can enter their question. Next, I want to tell you about the chat. So you can chat with us in Zoom as well. However, we use chat for when we ask a question of you. So we may be asking you a question, or we may actually chat out a link for some information that you want to know a little bit more about. You just click on chat where you see Ali's pointing there, and then the chat window opens up. You can simply enter your comment and push enter, and then we will receive your comment. We will be chatting out a couple links today. We'll also be chatting out the link for the evaluation. So we ask that you do link to our evaluation at the end of the webinar. And then I also want to let you know that the handouts, the PDF of these slides, as well as handouts that our guests have made available to you, are already posted online. So you can go and grab those before, right now, or even after the webinar. I suggest you do it after the webinar so you can hear what our guests have to say. But thank you, Ali. I'm going to toss it back to you, and so we can get into the webinar.
Great. Thanks, Erica. And we're going to actually get started with one of those Zoom features. I'm going to orient everybody to our roadmap for today, but as we do that, we want to hear from you. So Erica's going to open up a poll. And we just ask that everybody would share what sector you represent. And there's a couple of choices there, so just pick the one that's the best fit from you, and Erica will share some of those results here in a minute. But as people are responding, let me just sort of like I said, take you through the roadmap. We're going to start by framing the issue and talking about the intersection between economic development and health. Then, as I've mentioned, we're going to hear from our guests and learn about the Monadnock Living Wage initiative. We'll have plenty of time for question and answers, and we're going to wrap up our hour together by sharing some opportunities to continue the conversation and next steps. So before I go on, Erica, how's that poll looking?
It's looking really good. I'm going to go ahead and end it in 5 seconds. 5, 4, 3, 2, 1. And thank you for responding. Let me go ahead and share those results. And as you can see, almost half of us are from public health.
Great, thanks, Erica.
You're welcome.
So just real quick, a little bit about who we are. County Health Rankings and Roadmaps, we rank the health of nearly every county in every state, and according to our theory of change, the rankings can be a catalyst for action that improves the health of everyone in a community. This model that you're seeing on the right-hand side is our rankings model, and it's one of our most important images because it shows what we use to determine the county health rankings and what influences health in a community. And in a couple of slides, we'll go into a little bit more detail about this model. We also provide resources to assist communities in moving from data to actionable steps to create opportunities for health, and I'll have an opportunity to share about some of those resources in a couple of slides. Now I'm going to turn it over to Linda, who's going to provide a little bit of additional information about the Monadnock region.
Great, thank you. So in the Monadnock region, we are trying to be the healthiest community in the nation. And back in 2007, we selected about 27 indicators to measure the health of our community, and we defined health very broadly. So there are indicators around child and adult poverty. We also are looking at educational attainment and more traditional things like healthy eating and active living, but 27 different indicators to measure the health of our community, and we're celebrating the 10-year anniversary of this initiative. Actually, we had a big event today. Next. A little bit about our community. We are 33 towns in what's called the Monadnock Region, which has about just over 100,000 people living in those towns. It's a very rural community. We have one major city, which you can see that red star. The name of the city is Keene, and there's about 23,000 people in that city. Nearly 30% of the households in our 33 towns have incomes of less than $25,000 a year. And about 24% of our individual residents who actually work either part-time or full-time make $15 or less per hour. We have similar health issues like being overweight and obese, where you can see 62% of our adults fall into those categories. And the leading cause of death in the Monadnock region, not unlike other places, is cardiovascular disease.
Great, thanks Linda, and I think that just provides a great overview for some of the sharing that you and Phil will do here in a few minutes. So when we start our webinars, we like to ask our audience to consider holding a guiding question, and let's keep this circling today. As we discuss economic development and its influence on health, how can you use local data, tools, strategies, and stories to understand and improve health in your own community? And so as you're reflecting on that question, as I had mentioned, we were going to come back to the rankings model. And this image shows our approach to health and is the foundation of county health rankings and roadmaps. This model shows that health is the sum of many parts. And so for some, if this is your first time with us, this may be new. And so I'm just going to take a minute and explain it. It shows the relationship between policy, health factors, and health outcomes. And so it makes it the model makes clear that good health includes many factors beyond medical care, including housing, education, jobs, access to healthy food, and more. It shows us that all these factors impact how well and how long we live. So I'm just going to take a minute and walk through the model, and we're going to start at the bottom. I'm going to guide your eyes to the orange box that says policies and programs. And we know from research that effective local, state, and federal policies and programs can improve a variety of health factors that in turn shape the health of communities. Many health factors, and that's the blue boxes in the middle, shape our community's health outcomes. And we specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We measure 2 types of health outcomes to show how healthy each county is: length of life and quality of life. And the health outcomes are represented in the green boxes at the top of the model. So another way to think about this is that policies and programs can and do influence health factors, which in turn impact health outcomes, and multiple factors impact how well and how long we live. So just take a second and think about, how do you see yourself fitting into this model? And maybe if it's not you, how do you see your work intersecting with this model? And as you're thinking about that, let me translate the theory into a real life example that applies to what we're talking about in today's webinar. If we think about opportunities to improve unemployment by providing job skills training and creating the conditions for employers to provide more fair paying jobs for all, this will lead to higher levels of income, which make it easier to access healthy foods, clinical care, and quality housing, which in turn influence health outcomes. So through that example, you can see that there are multiple factors that shape health outcomes. So moving from the rankings model, the next image I want to share with you is our take action cycle. And this shows that in order to address health effectively, multiple stakeholders have to be included in the conversation. That was part of what prompted our thinking for the poll question at the start of today's webinar, and you can see the multiple voices and the multiple stakeholders represented in this image in the center with the blue circles. From there, I would take you to the action steps around the cycle, and on the right-hand side, you can see assess needs and resources all the way around to evaluation. Work together and communicate encompass the entire cycle, because those action steps are occurring concurrently as all of the others are happening. They're continuous and ongoing. So I would encourage everybody to visit our website and take a look at the Take Action cycle, and this is where you can access the hundreds of practical tools and resources that support you in moving your work forward. And lastly, I wanted to raise up from County Health Rankings and Roadmaps our resource called What Works for Health. And often partnerships, collaborations, folks working in community ask about best practices or evidence-informed programs that they can implement, take action on to address health. And in response to that question being posed, we've developed What Works for Health. And What Works for Health contains a menu of policies and programs which have been vetted by our team of analysts and assigned an evidence rating. And our evidence scale goes from scientifically supported to evidence of ineffectiveness. And what I like about What Works for Health is not only are each strategy assigned an evidence rating, but within each strategy you can also find the description. We work to tell you what benefits you can expect from implementing the strategy and let you know if the strategy is likely to have an effect on disparities. We know that communities have limited resources and often don't have the personnel to research strategies to this extent, or at least start the process of researching strategies to this extent. So we've started the work for you, and you can visit What Works for Health online to begin your search for strategies. So today we wanted to highlight specific policies and programs from What Works for Health to help you think about how you might begin to take action at the intersection of economic development and health. The first 3 strategies that we wanted to share are related to employment. And the next 3 strategies focus on income. And we're not going into detail on these strategies today, but rather raising them up for consideration and thought, and would encourage you to visit What Works for Health online to see the full summary for the individual strategy. And as always, if you take a look at them and have questions, please reach out to us. We're here to help and walk through them with you. And now I'm going to turn it back over to Linda, who's going to share a little bit more about how income might impact health.
Thank you. So before I get into this, I did want to say that, you know, now all that's available through the county health rankings and roadmaps makes things so much easier than when we were first working on our initiative back in 2007. While our 27 indicators would fall into the buckets of what the county health rankings came up with for their framework, we didn't necessarily have a lot of resources to go to on what those best practice strategies would be. The Center for Disease Control was a great resource, and we actually ended up selecting most of our strategies from their list of what works. And when we were looking at the social determinants of health, including income and jobs, the Living Wage campaign, a living wage campaign is what came up as a top strategy that our community selected to work on. But we didn't get there right away, and I'll tell you more about that in a little bit. But it's really important for people to understand how income does impact our health. And it's probably very easy to understand that if you don't have enough money to cover various expenses, and maybe you're eating less high quality food, perhaps your housing is not the best apartment out there. You might have to be choosing between high-end childcare and sending your child to an at-home, maybe unlicensed facility where they're taking lots of kids and there's not really much policies that they're following. Transportation obviously could be an issue. Perhaps there's one car in your family and you're sharing it amongst multiple people. Do you have access to health care? And if you do, what does that access look like? And is it of the quality that meets the needs of your family? And, you know, less income obviously limits the educational opportunities that are available to you. College is very, very costly, and the lower your income, potentially the less likelihood that you'll be doing advanced education past high school. All of these factors, however, when you really look at them from a scientific place, what they actually do is create the production of cortisol in our brains. They trigger stress in our bodies, in our minds, and this stress raises our cortisol levels. Cortisol is a hormone that makes us sick in quantities that are elevated. Now we need some cortisol, and this relates back to early days as a human species when we were trying to escape from the saber-toothed tiger. It was a good reaction that we would be stressed, produce the cortisol, and that would cause us to get out of the way of the saber-toothed tiger. However, we don't have to run from the saber-toothed tiger anymore, but we do have probably a lot more stressors than we did back then. And they're compounded. And so elevated cortisol levels for extended periods of time that result from low wages. You know, if you're a family of 4 and you're making $7.25 an hour, the minimum wage, imagine the stress that's associated with not being able to afford really any of the things in this list here.
Yeah, and Linda, this is Allie. I'm wondering, I'm going to go ahead and go to the next slide, and I think you've got some data that can help illustrate what you were just sharing.
Yeah, so one of the things that we did was we really wanted to be able to show, or we wanted to find out ourselves, first of all, because we know that the literature is out there to show that health outcomes change with income, but we wanted to see what it would look like in our county. And so we took a number of different health-related issues and broke them out over those folks making under $25,000 a year and over $25,000 a year, and what the health factors would look like. So you can see in each case, and in particular, if you look at the smoking one, I think that one is the most dramatic in terms of the difference. So for those that are making under $25,000 a year, your risk of being a smoker is at about 10-11%. If you're making under 25,000, your risk is about 35%. If you're making over $25,000 a year, your risk is at much lower, at about 11%. That's a dramatic difference. And you can imagine you're producing all that cortisol from all the stress that's coming up for not being able to pay your bills, and your rent is so high, and food is so high, and all of that, that to manage your stress, you start smoking, because smoking actually does help. Nicotine does help, at least in the short term, to manage stress. But as you can see, there is a statistically significant difference across all of those other health issues, including high blood pressure, cholesterol, unhealthy weight, diabetes, and we could go on and on and on with all kinds of other diseases as well.
Yeah, thanks, Linda. And so we're going to hear from Linda and Phil more specifically about the Living Wage Initiative here in a couple of minutes. But now we're going to actually turn to the audience, and we would ask you to use the chat box to respond to this question. What do you find most pressing when you think about the intersection of economic development and health? And I'll kick us off with sort of my reflection to this question, but then Erica, I'd love to hear any responses that might be coming in. And so for me, it's really the opportunity to think about the overlap between public health and economic development, and finding the space to collaborate to create vibrant community. And Erica, are we getting any responses into the chat?
Not yet, but I tell you what, I'm going to encourage people to go ahead and still think about that question and enter your responses, and we can lift them up later. I know you want to move forward.
All right, thanks, Erica. And so as I get ready to turn it over to Phil and Linda, I just wanted to remind our guests to speak up. We were getting a little bit of feedback from our audience that it was a little hard to hear us, so we'll all work together to make sure we're speaking up so everyone can hear. And so over the next couple of slides, we're going to hear about the evolution of the Monadnock Living Wage campaign, some of the current activities, lessons learned, and next steps. And so Phil and Linda, to kick us off, I thought, just tell us a little bit about how the Monadnock Living Wage campaign got started. I know it was an initiative of the local health coalition. And so how did this become a priority for the region?
So when we convened our community back in 2010 to look at the 27 indicators of health that we had selected and set targets for, we brought them through a process to identify 5 top goals for then selecting strategies that could address the issue. And one of the top goals was increased wages and jobs. And it sort of, sat on the books for a while. I mean, we went through the action planning and came up with the Living Wage campaign as one of the issues, because there wasn't really a whole lot in terms of what works for health. The research is, we still need more research to support even the impact of living wages on health outcomes. But the community did select a living wage campaign as a strategy that it wanted to work on, but then it sort of sat on the books for probably about 4 years, because it was easy to identify partners to work on things like healthy eating and active living, even though we were more focused on population level changes like safer streets for walking and biking and more farmers markets and those kind of things for healthy eating. But we just didn't have the partners. We didn't have the people. And then in 2014, our guiding group called the Council for a Healthier Community said, well, we got to get on this income thing. We got to start working on this living wage strategy. And so in the absence of a group to actually work on it, we created a group. We called it the Living Wage Work Group to start with, that then morphed into the Monadnock Living Wage Coalition.
Great. And before I go to the next slide, Phil, did you want to chime in with anything?
Well, I think it's important to note that this initiative came out of the public health dialogue. And as was seen early in this webinar, there aren't many business people on this call. So the business community was kind of a little bit late in getting attached to this. We can talk a little bit about that more later.
Great, thanks. And Linda, I know you had mentioned the magnitude of partners, and I know that's what this slide is representing, but feel free to share a little bit more about some of those partnerships and collaborations.
Yeah, so we just put a call out to the folks that we had been working with on some of our other healthy eating, active living strategies, and said, okay, it's time to start working on this living wage issue. And we convened various individuals from, different sectors, including the business sector. And we really wanted to ensure that we had all of the sectors represented at the table. We didn't know exactly what we were going to do yet, or how you create a living wage campaign. But we knew that if we brought people from our community who care about the people in our community, if we brought them together, that we'd have the resources to be able to make it happen. And that's exactly what we did. And so these folks probably, the biggest thing they did right at the beginning was to create a methodology for calculating a living wage for the Monadnock region, and then first some guiding principles for calculating a living wage, and then the methodology, which I'll talk a little bit more about. But we live in a community where relationships, collaborations, networking, very, very commonplace. And so we really have a leg up in that arena. And I think it's so critical, regardless of the issue that you're working on, but in particular, these issues that impact the social determinants of health. You've got to have all those sectors and lots of people ready, willing, able to get in the trenches with you.
Yeah, great. Well, so now why don't you just share a little bit about the goal and activity of the Monadnock Living Wage Coalition?
So when we convened, we said, well, we have to create a plan and an organizational structure for the launch of this living wage campaign. And we set as a goal recruiting 50 employers to participate in the campaign. We didn't know exactly what it was going to entail yet. But we knew that if we were going to make an impact, we had to have more than just a handful of employers participating. We did decide that it was going to be a voluntary campaign. We were not going to go the route of a minimum wage legislation. That was a very early decision. And that was because we just knew that we'd probably have a lot more success working with those folks that we kind of called at the beginning the early adopters, those people that might be highly motivated to join a campaign because it was more the right thing to do. They want to treat their employees like family, and all of that, and then build on those bright spots. For other folks, we knew that we needed a good case for support. What's the return on investment for businesses who might get involved with this campaign? How would the campaign potentially impact recruitment, retention, productivity, all those kinds of things that employers care about? We had to identify and align not just people resources, but financial resources to kick off the campaign. And we decided that we would, instead of getting like all our ducks in a row for the actual campaign, because we had some pretty heavy duty discussions about, the definition of a living wage and, how to approach this. And, there were some people that really felt like, everything that we put out has to be perfect. Like we cannot make any mistakes. And then a whole other group were sort of like, hey, we got to move forward with this. We got to get this going. And so for those folks, we started talking about this idea of a microburst campaign. What if we just recruited 5, 6, 7 employers who would sign a pledge to offer the living wage to all of their part-time and full-time permanent employees by 2020. And that really resonated with people. So that's the way that we decided to go.
Great. And let's go back to something you just mentioned. One of the things that you guys did early on was think about what is a living wage. And I'd wonder if you could share not only what is a living wage, but how you view it differently than a minimum wage.
Yes. So there are lots of definitions out there for living wage. And we, New Hampshire, and I'm sure this is not different in other parts of the country, we want to do things the New Hampshire way. We feel like we are so unique from everybody else that we've got to create our own definition for living wage. So there was just a lot of discussion, a lot of wordsmithing. I want to say we might have spent, 10 to 15 hours of collective work from probably about 30 to 35 people on just the definition of a living wage alone. But this is where we ended up, the hourly earnings that an individual would require in order to maintain a safe and decent standard of living. And what that meant to us was, modest. We weren't going to be living high on the hog, but it was going to be an adequate standard of living, which is different from sort of just barely covering your expenses. We wanted there to be some quality to your standard of living.
Great. And so why don't you share, you shared a little bit about where you've been and how you got started, but share some of your accomplishments and impact with our audience.
Yes. So we did that microburst campaign at one of our Healthy Community Summits, where we convene usually hundreds of members of the community to give them an update on the initiative, to broach a new topic with them at our summit. Today, we were looking at the connection between economic development and health outcomes, not specifically to living wage, but really focusing on how do we, as a rural community, where our economies all over the country are starting to sort of go down the tubes, how do we relook at the concept of economic development to build on our bright spots and build our economies, boost our economies up, not all take off to the cities. But as far as the living wages was concerned, we did launch that microburst campaign at one of our summits in May 2016, and we had 7 employers who had signed on as early adopters. We actually have had 3 employers sign on just recently, so we're up to 10 employers. We moved from a work group to a coalition, and we actually have a formal coalition sign up that gives folks, helps them understand like what's their role in this campaign, what are we asking of them, what are we not asking of them. We developed a communications plan for outreach and education around the campaign and the issue of living wages. And we developed a brand, which you can see our logo and one of our taglines to the right there. and we launched a Living Wage website.
Great. And along the way, what were some of the lessons learned?
Yeah, so we did learn that our early adopters, those 7 employers that came on initially, were really motivated to do that because they were interested in doing the right thing by their employees. They really saw their employees as their family. And I remember one of the early adopters saying, you know, I have to think about, could my mother live on the wage that I'm paying, you know? And I thought that was an interesting way to think about it. And, you know, we all want our mothers to do well, or most of us want our mothers to do well. So, you know, really thinking of their employees as family. They did recognize right away that increasing base wages to the $15 an hour, which ended up being our living wage here, did create what's called wage compression. So if you bring your lowest wage worker up to the $15 an hour, how are you going to change the wages for those that were already at $15 an hour, but maybe have more experience, more education, and the like? So that issue of wage compression is definitely something that all of the employers are struggling with. Because really, if you're raising your baseline wage, then you're probably having to look at the wages all across the spectrum of your wage scale. For those folks that were not going to be early adopters, for those folks that maybe were more motivated by the business case, those things, those return on investment factors like productivity, retention, recruitment rates, all of those, we were really going to need a strong business case. And so we did create a one-page case for support, did a lot of research, found a lot of, through a literature review, found a lot of research to support those ROI factors. And we probably, the biggest lesson is this sense that there's so many employers in our region that fear this whole topic of living wages because they think that it's going to lead to a law around the minimum wage. And I think I mentioned that in New Hampshire, our minimum wage is $7.25 an hour, which is, and we don't even have an adopted state living wage. It's our state minimum wage. We just default to the federal. But there are a number of organizations that continue to work with legislators to submit bills about minimum wage. So our employers are more nervous about the legislation happening in New Hampshire and what impact that would have on their businesses.
Mm-hmm. And so I know that you guys are sort of in this constant cycle of continuous improvement and continuing to learn and grow. So what are some of your next steps?
Yep. So education and awareness is probably still the number one thing we need to do as part of our overall communications plan. It's great that we have the website. All of our materials are on there. We've got this beautiful brand. We've got this amazing coalition of organizations that are helping to shepherd the campaign. But there's still a lot of misunderstanding about what living wages are, what they're not, what's our definition, how does that align with other definitions. You know, there's just a lot of education that goes along with this topic area. So we are continuing to go to any group that wants us to go and talk to them. And we even just will meet with individual employers who perhaps have reached out to Phil, who's on the call here, as the chamber president, to say, hey, what's going on with this living wage thing? Tell me, you know, I need to learn more, and we'll get together and talk about it. We have leveraged resources. to provide some leadership over the next couple of years to both the coalition and the campaign. We are continuing to engage and support new employers. We have one of our partners, the Hannah Grimes Center, will provide technical assistance to employers who are struggling with issues around, wage compression, or, whatever the issue is, whatever the barriers are to them getting to that baseline wage. Hannah Grimes will provide technical assistance to work with that employer to see if they can come up with some creative ways to address those issues. We'd love to be able to leverage some resources from some of our state foundations and local foundations, and we do see building statewide capacity for this issue. We're a small state. We have just over 1 million people in our state. So we could have huge impact on the health of our people if collectively as a state we were all working towards living wages for all of our working residents.
Great. And I know we want to leave time for questions from our audience today, but there are two tools that you've mentioned. One is the infographic, and the other is the living wage calculator. So just real quick, can you share a little bit about those two tools with our audience?
And Linda, this is Erica. Before you do that, I do want to break in, and forgive me for that, but I do want to remind folks to use the Q&A box to ask your questions. And if you are chatting a comment to our audience, please make sure that you use that drop-down box that says more, and make sure that the box, that is checked, that you're sending your comments to all the panelists and the attendees. So thank you so much. I appreciate that, Linda. I apologize for the break.
Okay, so this infographic just shows the methodology, or how we broke out the expenses for calculating the $15 an hour. We based our calculation on expenses for a 35-year-old single female, and part of why we did that was because we actually went on the exchange to find out what health insurance would cost for a 35-year-old woman. That's how we got the healthcare expense. So you can see in the pie chart how it breaks out, with the largest expense going to housing and utilities at 32%. 19% for transportation. In a rural community, it's almost a necessity you have to have a car. The healthcare, like I said, we went on the exchange. Taxes are pretty straightforward. The other category, there was a lot of discussion, but you can see in the purple that 21% covers food, savings, phone, personal care, household supplies, and clothing. But probably more importantly is the little box to the right in yellow. The calculation does not include any expenses for education, so college loans or any kind of educational costs, access to the internet, savings for retirement, entertainment, a movie or, something fun to do, or recreation, like, a vacation or anything like that. So no expenses were allotted for any of those categories.
Great, thanks. And I know in both thinking of the definition and of the calculator, you've shared previously that you had some guiding principles to help think about the framing for those. Is there anything else that you'd want to add?
Yeah, I think I've covered most of them, but I think it's really important to note that we went through this process. So before we even came up with the calculator and what the expenses were going to be, we came up with these guiding principles that we would agree on as we work together to do the rest of the work of this, to create the campaign. So getting those sort of group agreements down was really important, and took a while.
Great. And just real quick, I know you guys have done some analysis looking at, there are many living wage calculators out there, and so just share a little bit about these different calculators.
Yeah, so the MIT calculator, which is a basic needs calculator, different from what we came up with on the bottom there. MIT, you know, they've calculated what they call a living wage, which again is basic needs for communities across the country. Anybody can access an MIT calculator and find out what the living wage would be for their area. But you can see at $10.74 an hour, again, that's just basic needs, really basic needs. What they say in the fine print of the MIT calculator, however, is we realize that this is a basic needs calculator. You may want to adjust the expenses based on local data. And so that's what we did. We, you know, looked at the rents in our community. We looked at the cost of clothing and dental cleanings, and you know, you name it. We looked at what would it cost here in the Monadnock region. And so by doing that and by defining our living wage as modest but adequate, different from basic needs, we came up with the $15 an hour, or the just over $31,000 a year. But again, it was based on a 35-year-old woman. You know, we're not changing the living wage for, you know, a family of four, but know that if you were calculating it for a family of four, it would be double this at least.
Great, thanks. And as we get ready to transition to question and answers, we just wanted to let everybody know that you can visit the Monadnock Living Wage Calculator is available online, so we'd encourage everybody to check that out. And I believe that, I know the link is in the resource page if it's not being chatted out right now. And so with that, Erica, I'm going to turn it over to you. Thank you, Linda, for that great walkthrough to facilitate our Q&A.
Thanks, Allie, and I want to thank Linda and Phil as well for joining us today. And Phil, I'm actually going to start with you. I want to say we've had wonderful questions that have come in even before the webinar started. So here's one that actually came in earlier this week. How can we persuade fiscal conservative policymakers to support a living wage?
That's a great question, and there's not a real easy answer to it, but let me try it this way. The way that the Chamber of Commerce, or our Chamber of Commerce, looks at this issue is really through the lens of workforce and workforce needs. And from our perspective, workforce has two sides to the coin. One is the supply side, where you try to train up as many people with the right skills to push out into the workforce as possible. And the other is the demand side. And that is, you know, what are employers doing that are successful? So what we look at is, what are the companies out there that don't have a workforce problem, and what are they doing? And we have several of examples of that in our region. One that comes to mind, some people may be aware of, is called WS Badger. They're a light manufacturing company, the healthcare products, and they do not have a workforce problem. They never advertise their job openings. They only put them on their own website. And within 24 to 48 hours of advertising for any position, they get 100 to 200 applications. So I said, well, that's interesting. What are they doing? And what they're doing is they're paying a living wage. They're serving a free organic lunch to all their employees. And they're about 80 to 100 employees, somewhere in that window in this company. They have on-site daycare. So that's the kind of thing that on the demand side really affects workforce as well as the supply side. And
Right.
they don't have to do any of these things. They're not legally required to do any of these things, but they do, and they don't have a workforce problem.
Because they're meeting the needs of the employees. I mean, they're really looking to be able to provide those benefits for them. So that's great. You know, along that line, I'm going to ask you another question that came in, and that's related to health insurance. And we know that getting health insurance is becoming challenging with some jobs. When we do find that jobs that do offer a living wage sometimes don't offer health insurance. So one of our attendees wanted to know, how can we advocate for employers to give a living wage, but also advocate for them to be able to provide health insurance?
That's another great question. I wish I had a snappy, kind of snap my fingers answer to it. There's a similar kind of discussion that goes on when it comes to full-time versus part-time employees. So that's a real stumbling block for a lot of small businesses, and we're mostly small businesses. Are they automatically, ineligible for any benefits in an organization, or should they be eligible? Most people that are at the 725 level, in our experience, and many people in our area are paid way higher than that. Higher skilled jobs pay higher wages, irrespective of what the floor is. But many of the people don't have health insurance to begin with if they're at $7.25 an hour.
Right.
So it's not really taking something away, but we are trying to encourage our companies to try to redefine or reframe what the relationship is between the employer and employee. And, what is the nature of work? There's been a lot of studies recently that say within a few decades, there won't be any such thing as an employee as we know it today. So we're trying to get people to think about their employees as an asset, not a cost. If you think about wages as costs, and costs are bad, then you're not off to a good start. But if you think about them as an asset, and an asset worth investing in, then you can begin to have the conversation. And I would encourage people on the call to reach out to their local chambers of commerce. And if anybody would like some help with that, I may know some of them or know who some of the people are. But if you'd like some help trying to frame this issue with your Chamber of Commerce, I'd be happy to help.
Oh, that'd be great. I'm going to ask you one more employer question, and I'm going to give you a break for a little bit. But so one of our attendees asked, what are your suggestions that you would give employers to plan for wage compression and protecting employee costs for the future? I'm not a business person, so I'm not understanding what that means. So you might need to translate that for the rest of us before you answer it.
Well, the wage compression means that if you raise somebody from, let's say in a restaurant, you raise somebody from or some other kind of small business, you raise them from $7, $8, or $9 an hour up to $15 an hour. What do you do with the people who were making just over $15 an hour before you did that? So they might be the supervisors or something like that. So there's kind of a reverse domino effect that can happen. And that's what's meant by wage compression.
Okay. So they want to know, how can you plan for that and protecting employee costs for the future?
Well, it's another great question. And, we talked about stress earlier. Mm-hmm. And, when I bring this up with some of our, local employers and small businesses, then, I don't want people to get the impression that everybody is, instantaneously fully on board with this whole idea. Because they say, well, I'll tell you about stress. Stress is making payroll. And if we got to go to $15 by next week, here's the keys to my store. So there's some resistance to it. But one of the things that's attractive about the way that we're going about it is to say, number one, this is voluntary. It's not a government thing. Number two, it does not have a deadline. We have a broad deadline that we'd like to get a certain number of people to buy into this idea, by year X or year Y. But we're not trying to say to an employer that this is easy. It is not easy to do this, and it takes some thought and it takes some planning. So to get everybody up to a living wage and to deal with the compression problem, may take 2 or 3 or 4 years. And that's one of the reasons why the technical assistance provided by one of our organizations in town is really important. They need some coaching.
Yeah. Thanks for I think it's important that you point out that this is not something that can be done overnight. It really does take some planning, and so that employers need to be thoughtful about how they move forward with this, so they can be intentional about it and be able to really meet the needs of their employees. So thank you for that.
And it's also not a panacea. I mean,
Mm-hmm.
this is one piece of a large mosaic that we loosely refer to as economic development. You know, there are lots of other challenges, particularly in rural areas, and some people on the call may be from those kinds of rural areas. But if I'd say things like housing costs or transportation or energy costs or broadband access or some of those things, those are all issues.
Yeah.
And this happens to be one piece
Right.
of the larger
Of the
puzzle.
puzzle. Yeah. Thank you so much. We did have a lot of good questions that came in and ideas that were sent in the chat box. We're going to attempt to get to some of those questions offline. Right now, I want to toss it back to Allie, because these conversations that are coming up sounds like it would be really great for us to address in our discussion group next week. Right, Allie?
Yeah, and Erica, you read my mind. And so that's what we wanted to share next with our audience, is that next Tuesday, November 14th at 3 p.m. Eastern Time, there's an opportunity to participate in a discussion group to continue this conversation and dialogue with colleagues from across the nation about what you've heard and learned today, specifically around economic development, living wage, and health. This is different than our webinars because it's facilitated. It's an interactive discussion where you can share what you're doing locally, as well as asking questions of others. Video conference is highly recommended, so you can meet and talk face-to-face, and this really helps in building a strong network around this topic. I'll note that capacity is limited, so sign up early, and I think we're chatting out that link to register. So if it's something that you're interested in, go ahead and sign up. When you register, we encourage you to submit the great questions and topics that you'd like to discuss. We're really pleased to be able to offer this focused discussion group session in partnership with Active Living by Design, and Joanne Lee, who's been with us today, will be the lead facilitator. So we look forward to having you with us for that conversation next week. Another opportunity to connect with us, in December, we're rolling out an updated look and feel to our website, countyhealthrankings.org. The new design will make it easier to find what you need when you need it. And so I'd encourage you to join us on December 19th for a virtual tour of the new site. On this webinar, we'll show you where you can find the data, evidence, guidance, and examples to move your community from data to action. We'll spend some time checking out our new Explore the Rankings page, introducing the redesigned What Works for Health page, and unveiling our new Partner Center and refreshed Action Center. And with that, we'd encourage you to stay connected with us through the various channels, both social media, Facebook, and our e-newsletter. We like to share what we're doing, but we also like to hear what you're doing and what's going on out there in your community. So stay connected. And with that, we'd like to say thank you. It was great having you with us, and we look forward to continuing the conversation next week at the discussion group.
Thank you, everyone.